Doctor, what is this CaReMe diseases? Because people think diabetes, heart issues and also kidney problems are separate. So what is your point of view? What is this CaReMe diseases?
So when we are thinking about patients and their diseases, we have to think of the diseases as a whole. Patients having hypertension and diabetes, they are likely to develop other diseases as well and end up with kidney problems, with heart problems and everything.
Is this true that diabetes is increasing in India? What is your point of view for diabetes in CaReMe diseases?
Yes, it is true that diabetes prevalence is increasing in India. Actually, it is increasing globally. As per the recent ICMR India study, in India, 1 in every 9 adults are living with type 2 diabetes.
What are the symptoms of kidney diseases and how a patient can predict that he is having kidney disease?
There are many symptoms of chronic kidney disease, some specific, some non-specific. There could be swelling of the limbs, swelling of the face, there could be froth in the urine, there could be multiple times urination in the night, and interestingly, gone are those days when we would think that I am a 25-year-old boy, I am a 30-year-old girl, I will not have kidney disease. No, this is a myth.
What is your one single advice to CaReMe diseases to our audience? So hello and welcome to this special podcast of cardiovascular renal metabolic disease, in short, CaReMe disease. If you or your loved one has any of this problem like high blood pressure, diabetes, heart problem or kidney problem, this episode is for you because we have the specialist of this CaReMe diseases. We will be discussing about this CaReMe diseases and I hope after this whole session, we all will be extremely informed about these diseases. So hello and welcome doctors. Today we are discussing about a very important topic on CaReMe diseases.
Hello everyone, I am Dr. Arindam Basu. I am practicing as a consultant interventional cardiologist in Nightingale Hospital, in BM Birla Hospital and in Amri Dhakuria Hospital, Kolkata.
Hello everyone, I am Dr. Amitabh Sur. I work as a consultant endocrinologist and diabetologist at PLS Hospital, Kolkata and SSRM Diagnostics, Bangor Avenue.
Hi everyone, this is Dr. Vivek Goyal. I am a consultant nephrologist and kidney transplant physician. I work with Apollo Multi-Speciality Hospital, Kolkata. I am also a national faculty for NEET Super Speciality Entrance Exam, through which candidates enter into the DM-DRNB nephrology program. Today we've gathered here to discuss about the cardiorenal metabolic disease, popularly now known as a CaReMe disease, and I hope that we both learn mutually and propagate a healthy lifestyle. Thank you.
So my first question to Dr. Arindam. Doctor, what is this CaReMe diseases? Because people think diabetes, heart issues and also kidney problems are separate, but that is not true. They are interconnected with each other. So what is your point of view? What is this CaReMe diseases and also how important it is?
So when we are thinking about patients and their diseases, we have to think of the diseases as a whole. Patients having hypertension and diabetes, they are likely to develop other diseases as well and end up with kidney problems, with heart problems and everything. So this is the concept of the CaReMe diseases, that a patient having hypertension can develop diabetes, can develop CKD or chronic kidney diseases and also likewise.
Of course, that's a great point. Next, I would like to ask Dr. Vivek, what is your point of view and your perspective? How does kidney gets affected in CaReMe diseases?
So basically, there are millions of nephrons in our kidneys. And our kidneys function exactly in the same manner, just like the filter, the water filter in our house functions. So what happens is, due to diabetes and blood pressure, the pore size of these filters increase due to the excess pressure these diseases exert on the kidneys. Due to the increased pore size, what happens is, there starts to be leakage of protein through the kidney. Gradually, this protein eats up the kidney because it creates an inflammatory milieu and it causes progressive damage of the kidney. We all know that chronic kidney disease is an irreversible progressive disease. So once it starts, we cannot do anything but wait for the kidney to progress and ultimately culminate into end-stage kidney disease.
Next, I would request Dr. Amitabh to share your viewpoint, because metabolic issues are at the center of CaReMe diseases, right? So, how would you like to explain to our audience?
Yeah, diabetes, heart diseases, and kidney diseases are interrelated to each other. In fact, diabetes is the most common cause of coronary artery disease, heart failure, as well as chronic kidney disease. And the most common cause of death, if you say, in patients who are living with diabetes is actually coronary artery disease. So all these complications are interrelated to each other, although there are so many things to say. But insulin resistance is a common soil which actually is responsible for all of these problems. Now, the good news is, if we can maintain good glycemic control right from the beginning of diabetes, and along with that, not just glucose control, if we take care of these metabolic complications right from the beginning, then the chances of patient getting or developing these complications come down a lot. So we can do a lot to slow down this process.
Very true, very true. Thank you so much, doctors. Now it's time that we discuss about the burden of CaReMe diseases in India. First, I would like to request Dr. Arindam Basu to share your point of view. Doctor, we keep hearing that diabetes, heart diseases, and also kidney problems keep rising in India. So what is your point of view on this? Actually, this is a burden that we are facing right now?
Oh yes, most definitely it is, because diabetes, as we know, India has become the diabetes capital of the world.
Yeah.
And it's also taking on the other chronic diseases. So the most common cause of death in our culture now is almost universally, it is ischemic heart disease or other heart diseases. While a decade ago, maybe 2 decades ago, it was infectious disease as a whole. So there has been a major shift in this regard. And also we see that the diseases that we are talking about, the CaReMe diseases, they are affecting the population of India much earlier than they do in the Western counterparts. So we are getting affected, say, in the late 30s or 40s, while our counterparts in the Western countries and the US, they're getting affected in the late 40s to 50s. So definitely it's increasing in our country.
Very true. So next I would like to ask Dr. Vivek, how certainly or how commonly you see this disease, CaReMe diseases, that you see in your clinical practices?
So, the burden of this CaReMe diseases cannot be undermined. The prevalence of diabetes is increasing day by day globally as well as in India. We do know that India is the diabetic capital of the world.
Absolutely.
So according to the last data, there were more than 110 million diabetics in the country.
Yes.
The prevalence of hypertension is approximately 10 to 15%, and it increases with each passing year. And as one approaches above the age of 60, the prevalence increases up to more than 50%. With regard to coronary artery disease also, the prevalence is really alarming. So, day in and day out, we see chronic kidney disease patients, because approximately 1 in 10 people are inflicted with chronic kidney disease.
Absolutely, yes.
Such is the burden of chronic kidney disease. And we do know that because it's an irreversible progressive disease, the burden is only to increase. Both hypertension and diabetes, that is blood pressure and blood sugar, constitute more than 60% of the burden of CKD. So if at the grassroots level, we are able to control the blood pressure, we are able to control the blood sugar, we are actually causing a great benefit to the prevalence of chronic kidney disease.
Absolutely.
That is why my appeal to the general physicians, to the physicians who see the patients at the grassroots level, is to please test all diabetics, test all hypertensives for markers of kidney damage. Please do at least an annual serum creatinine, do an annual urine checkup, because it is so disheartening that even in urban patients living in urban areas, we see patients achieve advanced chronic kidney disease without having ever been tested for markers of kidney damage.
So the awareness is very important.
Awareness is very important. That is why test should be the motto of all patients who are affected with these diseases, because prevention is always better than cure.
Absolutely. And right time diagnosis is very important. Next, again, I would request Dr. Amitabh to share your point of view. Is this true that diabetes is increasing in India? What is your point of view for diabetes in CaReMe diseases?
Yes, it is true that diabetes prevalence is increasing in India. Actually, it is increasing globally. As per the recent ICMR India study, in India, 1 in every 9 adults are living with type 2 diabetes. And if you also include number of people living with pre-diabetes, then the number will be 1 in 7. So you can appreciate it's a very, very big problem. The diabetes is increasing in younger population. Nowadays, what we see in our practice is in the second decade of life, after puberty, earlier the most common reason for developing diabetes used to be type 1 diabetes. But now what we see is in second decade of life, in type 2 diabetes, which is a metabolic cause related diabetes, has become the most common cause of diabetes. The government of India also says that all adults who are living, all adults actually who are above 30 years of age should get screened for diabetes at least annually. But what we have seen in our practice, diabetes is becoming even so common in second and third decade that probably this screening should not just start at 30 years of age, but it should rather start little early, maybe at 18 years of age. Annual screening should be done to tackle with this problem. What we have seen is poor dietary habit, eating lot of simple carbohydrates, sugar sweetened beverages, trans fat containing food, not doing enough physical exercises, and taking lot of stress. These are most important reason for rise of this metabolic problem. So this should be sorted out with appropriate measures.
Do you consider that lifestyle is one of the reason for this increase?
Yeah, as I said, growing stress, increasing consumption of simple carbohydrate and particularly sugar sweetened beverages, and not doing adequate exercise, maybe because of academic schedules or whatever it is. That is something. These are something very important reasons of this rise in the prevalence of an incidence of diabetes, and not just diabetes, as you have already said. The other disease which is part of this CaReMe spectrum, the prevalence of hypertension, the prevalence of coronary artery disease, the prevalence of chronic kidney disease, all of them are increasing in our country and in our part of the world. So we should be becoming more conscious on it.
Absolutely. Dr. Arindam, would you like to say anything about the lifestyle point of view?
Like Dr. Shur said, that definitely lifestyle modification is something that we should be focusing on much more right now, because obesity is increasing. It's increasing like anything, and the main cause of obesity, apart from sedentary habit, would be diabetes, early onset diabetes in younger population, and also hypertension and other diseases. So these need to be screened at an early age so that we can get to the main bottom of the disease that we are talking about.
Absolutely. And also routine checkup is very important. Whether you are getting the symptoms or not, still you will suggest that every individual should go through a routine checkup without considering that I am very young or my age is very less.
Completely true, because all these diseases are actually asymptomatic. They do not cause symptoms usually. They can cause symptoms, but usually when the severity is high or there is end organ damage, only then symptoms appear. So otherwise symptoms may not appear.
So coming back to this point, I would like to request both of you to share what are the symptoms specifically and respectively for heart and also for metabolic reasons.
From the cardiac aspect, I would say that the main symptoms that we see are mainly chest pain, or which we call as angina, or there may be shortness of breath, which may be exertional with walking, with climbing of stairs or anything. Apart from that, there may be some pedal swelling, some swelling of the legs, palpitations, all these may be there. But many a times we do see patients who are completely asymptomatic, like you said, especially diabetic patients. They don't have exact symptoms, and many of them do end up with even myocardial infarctions without having any obvious symptoms. So symptom wise, I don't think we should stress so much on the symptoms. Rather, screening should be much more important in our society, because we have a large population to deal with, and proper movement of resources to tackle this problem is very essential to identify the group to which we are targeting these resources.
True. Over to you, doctor. What are the symptoms that we normally notice in a diabetic?
Yeah, that's a very common question from patients also, that how can we know that we are having diabetes. So actually, unfortunately, for majority of people who are having diabetes, who are currently not diagnosed, I'm talking about them, they may not have any symptom at all. There is no specific cutoff beyond which, if there is a glucose value is higher than that, then that will cause symptom. But it has been seen that higher the glucose values, more is the chances that the patient will get some symptoms. Okay. Now, usual symptoms which can come up when the patient's ambient glucose value is quite high can be polydipsia, that is, patient's thirst will increase.
Okay.
Polyphagia means patient will become more hungry, more often hungry, and weight loss.
Okay.
So patient will patient will lose weight. So these are called osmotic symptoms in our technical language. Apart from that, if there is some end organ involvement, like if heart is involved, as sir has already said, then patient can have chest pain on doing exertion. If eyes are involved, patient has developed retinopathy, or may not be retinopathy but lens is clogged with glucose, then the patient can develop visual blurring, or the patients can develop painful tingling, numbness in the limbs, upper limbs, in the hands, in the feet, burning sensation. That can be because of nerve involvement, which is again a kind of end organ involvement. Frothy urine can come because of, or urine output, urine volume can reduce. So all these are symptoms which are coming from the end organ. And as I said, the earlier part, osmotic symptoms, they are not coming from end organ damage, but they will come only when the glucose values are very high. So we have to keep these symptoms in mind, but symptoms and waiting for symptoms can be deceptive. Best strategy is to get yourself screened. I will say 18 years and onwards, annual checkup, but if not feasible, at least from 25 years, and as per the government of India, it should be 30 years.
Okay. So, what are the main diagnosis process that we follow during this CaReMe diseases?
So, if you talk about diabetes, diagnosis of diabetes is relatively easier compared to heart disease. Diabetes can be diagnosed very easily by doing a fasting plasma glucose test for someone who is not diabetic, or oral glucose tolerance test, where we ask patient after an overnight fasting to consume 75 gram of anhydrous glucose, or say 82 gram of normal glucose which is available, and to be dissolved in 200 ml of water. The patient has to take it in a time of 10 to 15 minutes, and from beginning of that 2 hours after taking the consuming that thing, we need to check the glucose, or average of 3-month glucose, which we call HbA1c. So any 3 can be used. Ideally all 3 should be used. Okay. If any one of the value is unequivocally above the cutoff, that is fasting we say 126 and above, OGTT, that is oral glucose tolerance test, we say 200 milligram per DL or above. For HbA1c we say 6.5% or above. So if any one value is unequivocally more than normal, okay, or any 2 values are positive, okay, or even if there is marginal elevation, say for example someone's fasting plasma glucose is 128 milligram per DL, but rest of the 2 values are normal, so that's only a marginal elevation, it's not an unequivocal elevation, then we suggest to repeat it, and the repeat value is also abnormal, then we say that the patient is diagnosed with diabetes. We have to be little sensitive while diagnosing diabetes, because diabetes is almost a lifetime diagnosis. Almost, because for diabetes also sometimes remission happen, but it is almost a lifetime diagnosis. So these are the things which we need to keep in mind.
Dr. Origo?
Coming to the cardiac part, it's not so straightforward, because we rely on the number of risk factors that the patient have. So if the patient has hypertension, the patient has diabetes, if the patient has cholesterol levels, these have to be checked. So blood cholesterol, blood sugar levels, an ECG and an echocardiogram, these are the basic tests that we rely on. But like I said, that symptoms alone don't dictate what we should be doing. So many patients who have current smoking habits or have a strong family history also, we put them through the tests that are relevant, and we end up with the diagnosis whether he or she has any risk factors or has already developed some heart disease or not.
Next, I would request Dr. Vivek Goyal to share what are the symptoms of kidney diseases and how a patient can predict that he is having kidney disease.
So, a very interesting question, ma'am, a very pertinent question. There are many symptoms of chronic kidney disease, some specific, some non-specific. There could be swelling of the limbs, swelling of the face. There could be froth in the urine. There could be multiple times urination in the night. There could be bloody urine, cola colored urine. There could be non-specific symptoms like lethargy, getting up early in the morning and not feeling like going to the office, fatigue, high blood pressure, headache, nausea, vomiting, not feeling the urge to eat. But the crux of the matter is all these symptoms come usually when the train has already left the station. What I mean is, in early stages of kidney disease, there are usually no symptoms. It can only be detected through screening tests. That is why I was emphasizing in the previous question also that if you are having a risk factor, be it diabetes, be it blood pressure, or if your first degree relative has had a kidney disease ever, please go for a routine checkup. And interestingly, gone are those days when we would think that I am a 25-year-old boy, I am a 30-year-old girl, I will not have kidney disease. No.
This is a myth.
This is a myth. There is no age barrier. As young as anyone to the most elderly people can have kidney disease.
Absolutely.
So please, awareness is the key and getting tested is very important.
Absolutely. We all agree with doctor that no matter you have symptoms or not, go for a routine checkup so that you are safe, and also prevention is better than cure. So we have discussed about the problem. Now it's time to know about the solutions. So I would request Dr. Arindam to share. Doctor, as we know that CaReMe disease treatment is like treating heart, kidney and metabolism together. So what is a successful treatment for CaReMe diseases and how it looks like?
Okay, so first point first, that is that we have to treat the person as a whole.
Yeah.
We have to see what are the risk factors or what are the diseases that the person already has.
Yeah.
Next comes the diagnosis point that we just discussed, that if the patient has so and so risk factors, those have to be addressed individually.
Yeah.
And it's not that the person only has a hypertension today and will not end up with a diabetes or a chronic kidney disease in the long run. So we have to focus on that as well. So treatment actually encompasses diagnosis and management, both. So this diagnosis part is very important. Once you have diagnosed the patient, then stringent goals have been set by various guidelines, Indian guidelines, Western guidelines, that have to be adhered to, and the patient have to be followed up at regular intervals. So hypertension, there are numerous agents that we have today, numerous newer agents which have effects beyond control of only hypertension. For diabetes, we have newer drugs like SGLT2 inhibitors, which have a very good effect on the heart as well as on the kidneys. And also for the other diseases like cholesterol metabolism, or for control of obesity, we have newer drugs coming up and also in the pipeline, and also some drugs which have multitude roles. They have roles in metabolism, they have roles in diabetes, they have roles in hypertension control. So these have to be calibrated and they have to be individualized for each patient. Finally, if the patient has ended up with some end organ damage, like some heart diseases, some ischemic heart disease, some heart failure, they might need some treatment beyond medicines, but that has to be, like I said, individualized.
Okay. And Dr. Amitabh, what is your point of view? How we can just control this diabetes in CaReMe diseases, and overall, what is your point of view? How we can treat diabetes in CaReMe diseases?
So keeping in mind the CaReMe approach, we need to take care of all the comorbidities which the patient is having or might be having in future, like coronary artery disease or CKD, right from the diagnosis of diabetes.
Yeah.
As Dr. Arindam already said, we need to keep in mind that the patient, even if today does not have coronary artery disease, can develop it in future. So right from the beginning, we have to keep the patient's glucose under proper control. Apart from that, blood pressure, lipids should be kept under proper control. Patient's body weight and BMI should be in the normal range. If not, then we need to use methods to reduce it. And apart from that, we need to carefully select agents which, apart from having good effect on blood glucose control, also has effect on reducing the comorbidities, like for reducing the incidences of MI, or by reducing the incidences of heart failure hospitalization, or increasing or delaying the progress of chronic kidney disease, like agents of SGLT2 inhibitors, GLP-1 analogs are helpful in this regard. So we should be considered using these agents from the beginning.
Next, again, I would request Dr. Vivek, what are the main methods and also how we can protect our kidney?
So, protecting the kidney does not involve any rocket science. So it is again coming back to the basics. You've got to cater to the risk factors. If you have blood pressure, please control blood pressure. It is a very sorry state of affairs that only 20% of hypertensives have controlled blood pressure. So 4 out of 5 people who have high blood pressure do not have it under control. So do a regular monitoring of blood pressure. Take your medicines on time. Control your blood sugar. Visit your endocrinologist routinely. Take your medicines in time. Check yourselves regularly for kidney tests. And if there is any aberration, please visit a nephrologist. There are certain medications in the form of ACE inhibitor, ARB. There are SGLT2 inhibitors. Now we have finerenone, GLP-1 analogs. This may not be pertinent to the general population. These are the names of the drugs. But we have all the armamentarium to give it to you at the right stage to protect your kidneys. But what is sorry is most patients come late and then we don't have much to do. If the patients come to us in time, there is a lot of things that we can offer the patient.
Yes, and I would like to extend this question that does lifestyle routines and everything can affect this diseases?
Absolutely. Actually, this is a lifestyle disease. What I always tell my patients and what I see, the lens that I see these diseases are, I always look it as a package. Don't consider blood pressure, sugar, kidney disease, lipid, cholesterol as separate diseases. It comes in a package. So, if you are inflicted with one, your chances of having another, they increase multiple times. So, going to the basics, aerobic exercise daily, 45 minutes a day, cessation of smoking, sedentary lifestyle. Our generation is the Instagram and the mobile generation. We spend more time on the screen rather than on the grounds. So, please, to all the children, please inculcate in physical activities. Don't have aerated drinks and the cola drinks. They have a lot of sugar. So all these, most of which you already know, refrain from them and please follow a healthy lifestyle.
Yes, true. So what we understood from all the answers that doctors said, that lifestyle, small changes in your lifestyle can make a big difference. So please make sure that your lifestyle is very healthy and clean.
Absolutely.
So now we have come to the end of today's podcast. But before we wrap up, I want to extend this question to all the doctors, that before we end up, what is your one single advice to CaReMe diseases to our audience?
Well, first of all, like we have been saying throughout the podcast, we should treat CaReMe diseases as a whole. They are as a single entity. They have to be treated. And this treatment should continue most likely for a lifetime. True. That has to be kept in mind.
Yeah. Dr. Amitabh?
My message is, right from the diagnosis of diabetes, we should advise our patients to maintain lifestyle modification, including diet and exercise as recommended by the doctor, and to have good glycemic control right from the beginning, and to avoid stress as much as possible.
Over to Dr. Vivek.
So, closing remarks are again the same. Prevention is the key. If you have risk factors, get yourself tested. Visit a consultant nephrologist if you have any of those issues. Follow a healthy lifestyle. Stop popping a pill. You have a headache, you go to the pharmacy, take a painkiller, and you land up in a kidney disease. Please stop that. Stop consuming excess salt, fatty food, sedentary lifestyle. Lead a healthy lifestyle. Drink ample amount of water, and please control your blood sugar and blood pressure. Thank you.
Thank you to all the doctors. Thank you so much for sharing this information with us. I hope it was very, very, very clear to all the audience about the CaReMe disease, and I hope they will just check on their lifestyle and routine so that they can protect themselves from the CaReMe diseases. Thank you everyone for joining us. See you again in our next podcast session. Thank you. Goodbye.